Just a show of hands, how many practitioners do we have in the room? Health coaches, nurses, PAs, doctors? Great, good fair amount. So let's think about a patient shows up in your office. And this patient was about 60 years old. Little under a year before they came, they had had bypass surgery after showing up with advanced heart failure. They've been diabetic for 40 years, on insulin for the past 10 years, and at the time we're doing 33 units a day of insulin, fairly hefty dose, and despite that, their A1C was still 7.2. They were on a bunch of other medicines that you see there, Jardiance, the insulin. They were on the isosorbide because they were still having chest pains after their heart surgery, and yes, they were on a statin. And the patient shows up complaining of low energy, leg cramps, they're short of breath with activity. And they said, I've been doing dirty keto for 5 years, is how they described it. They had had an echocardiogram showing reduced heart function and ejection fraction of 45%. So as a practitioner, what do? What's the first thing you do when a patient like this shows up at your office? Well, you run like hell the other way, and you say, let me find someone else to send this patient to, because this is a scary patient, right? They've already had bypass surgery. They're still having symptoms. They are a mess. But the reality is that there are patients like this everywhere. There are probably patients like this in this audience. And as practitioners, we need to be able to take on the hard cases